Hello everyone, my name is Dr Prashanth Bagali from MedGenome Labs. January, we observe Thyroid Awareness Month. Today I would like to talk to you about a small gland which is located in the neck, and it is a butterfly shaped gland which is called thyroid. So thyroid, you would have heard about the thyroid and the thyroid gland, but any imbalance happens in the thyroid and a thyroid dysfunction causes a lot of severe health implications. So not only in the woman but in the children and in the elderly people. So in the children also, if there are thyroid hormone dysfunction happens, it disrupts the development and the growth and the overall physical structure of the body. So in the woman of the childbearing age or the reproductive age, it can disrupt the menstruation cycle or the infertility related causes. So next we will see about what are those symptoms, but before that the awareness is very important because thyroid play a very important role in the metabolism, in maintaining the body weight and also in maintaining the body temperature. So it is very prevalent in the India because thyroid causes more than 4 crores people are suffering from thyroid related disorders, and about 1/3 of these people don't know only that the thyroid related issues they have, because they will have one or the other symptoms which will never be thinking about the thyroid related issues. So basically this is more prone in the woman, more than 5 to 8 times it is more in the woman of the reproductive age, but however it can affect both the men and the woman. Now let's understand what are these thyroid related symptoms, or what are different categories of the thyroid. So there are 4 main things which you need to remember. The first one is the hypothyroidism, second one is hyperthyroidism, and also you would have heard about the thyroid nodule and the thyroid cancer. So but very common one in Indians is the hypothyroidism, which is where the thyroid gland produces the less of the thyroid, so which results in the unexplained weight gain, the constant fatigue, the cold intolerance, constipation and hair fall and dry skin and menstrual irregularities, infertility, depression and all. So which many of the professional women will attribute that into the work related stress. The hyperthyroidism on the other side, where thyroid gland is active, very high active, so produces more increased level of it, their unexplained weight loss will happen, and palpitations, heart related issues, tremors, anxiety, mood changes and excessive sweating. So for many working women and men and women, they always ignore these symptoms. The third and the fourth one, thyroid nodules and thyroid cancers, are less common. But however, thyroid nodule, where you will find a small lump in the thyroid gland and also swelling of the thyroid gland will happen. So then you need to approach the endocrinologist, and wherever there is a family history of the thyroid, they have to approach the relevant doctors, because thyroid cancer may be a possibility. So if good news is that any of the thyroid cancer or the thyroid nodules, if it is detected early, is definitely it can be prevented and better results can be expected. So the thumb rule is that whenever there is a small swelling in the neck, or hoarseness of the voice, or difficulty in the swallowing and rapidly growing lump in the neck, you have to approach the endocrinologist. Many people ask, what are those factors which causes this thyroid gland related dysfunction? So please remember, it is a multifactorial one. So there are autoimmune diseases. So if there is a family history of autoimmune diseases, or there is a poor lifestyle also leads to this, or eating of lot of junk food and a lack of sleep, and also there may be genetic predispositions, and some female will have the pregnancy and postpartum changes, and some of them will have the iodine imbalances, radiation exposure, and some of the family related ones. So once we understand this, is there a possibility to prevent or manage this? Definitely yes. So 4 important things what I am going to today suggest to you is the early screening. So whenever you find any of these symptoms, you have to get tested. A simple blood test will able to identify this. and routine screening in your annual checkup for TSH and all, serum blood, you can have the testing. And second one is approach the endocrinologist if you have to know your thyroid levels are not controlled. So then it becomes a proper diagnosis need to be approached, and other parameters need to be looked for a proper diagnosis and a medication. So even after the medication, if it is nodules are not controlled, then please remember we have to do a genetic testing to know that whether the nodule is benign or malignant. So there is a Bethesda test class category of classifications, and we can take the FNA sample from these nodules and do the testing. So therefore it is very important that we understand the risk and have a proper treatment at the right time. So I would like to conclude by saying that thyroid disorders are very common, preventable, manageable, and even the reversible. But however, you need to have an awareness about the early diagnosis, better quality of life, and reduce complications. So get tested if the symptoms persist, and encourage your friends and family to be aware about the thyroid. Thank you very much.